let's talk about something that's totally overlooked in midlife care for Asian women, and that is heart disease. You might be surprised to hear this, but if you're South Asian, and especially if you're in your 40s and 50s, your risk of heart disease is so much higher than you think, especially if you're a woman. The Masala study, one of the most comprehensive US-based studies on South Asians, was started to understand why South Asians have this elevated risk of cardiac disease. South Asians such as people of Indian, Pakistani, Bengali, Nepali, or Sri Lankan descent, for some reason have an increased rate of heart disease beyond the traditional risk factors like hypertension, diabetes, or smoking. In fact, even if your weight is normal and your LDL cholesterol looks fine, you could still have plaque building up silently in your arteries. Now, you may be thinking, why is that? I live a totally healthy life. Well, it's because we as South Asians tend to carry more visceral fat, the dangerous kind that wraps around our organs, and we often have a low HDL, high triglycerides, and small dense LDL particles, which are far more likely to clog up our arteries. Now, the thought is that this is partly due to genetics and the legacy of colonialism, famine, and early life malnutrition in our ancestors that may have altered our genes. In fact, some studies say that 10 to 15% of our risk of cardiac disease is due to this. Our bodies became wired to store fat and conserve energy. So even if you're doing all the right things, you could totally still be at risk. Now, in fact, after menopause, when estrogen declines, our cardiovascular protection drops sharply. That's why this midlife window is super duper important. There are some things that we can do if you're South Asian and over 40 is to make sure that you talk to your doctor about a coronary artery calcium score that can detect hidden plaque. You can also ask for advanced labs like ApoB and lipoprotein A, because sometimes a basic cholesterol panel doesn't give you the full picture. And focus on strength training, cut down on refined carbs even though they taste so good, and consider a fusion of the Mediterranean and South Asian diets. And if you're a candidate and you're a woman and you want to consider hormone therapy, it can help increase insulin sensitivity and glucose uptake into your skeletal muscle. Now, I want you to remember this. You're not overreacting. You are not imagining your fatigue, your weight gain, your anxiety. Your body is going through profound change and the risk is real. So let's break the silence around heart disease in South Asian women. Let's demand better because we deserve better, and we deserve to thrive in midlife, not just survive. So if you are looking for a physician that gets all of this, that understands you, that won't dismiss you, then you need to call up our office at femvhealth.com and schedule your appointment today, because your future is waiting for you.